Hey, gang, it is Wednesday. And guess what? I'm changing it up a little bit. Our good friend, Dr. Chad Duplantis, couldn't be with us tonight. Got a lot going on the dental side. And Chatty, we're thinking about you, my friend. We're going to miss you tonight. But we got a great show for you. So, welcome to Dentists in the Know. This is your backstage pass for current trends, politics, and education in the dental world. It is live. As always, it is over some kind of a cocktail. Cheers to you, JB.
Cheers to you.
Thank you all for tuning in to Dentists in the Know. I've told you who we are. As you know, we are all practicing dentists. We are all educators and we are all business owners. I'm with my best friend in the world, Dr. Jennifer Bell, and my other best friend in the world, Dr. Chad Duplantis, who can't be with us tonight. But our job, as you know, is to bring all of you in the know. So cheers to all of you. Welcome. We've got an incredible guest tonight, a very timely guest, I might add. So stick around. We've got some great stuff. So with that, I'll quit yapping. I know you've got a lot of timely news for us. So we'll get to that and we'll bring our awesome guest on.
All right, you ready? Big
I'm
news
ready.
week. Do you want to stay up?
What if I don't go down and talk
Just
through your
stay
news
up.
segment?
Just
Okay,
stay
I'm
up.
staying up.
Yeah. So I'm sure you saw Chad sort of floated out the teaser post about Aspen Dental, and it brings up a couple of things. So first off, just for those of you who were not dialed into Facebook this week or the news outlets, Aspen Dental had a major cybersecurity event. It impacted over 1,000 offices, which is a pretty big hit. And I think it impacted their EHR, their scheduling. I mean, you know how our practice management software controls the finances, the patient schedule, their access to records, like everything is sort of housed within your single EHR software. And so it was a pretty big, impactful event. And I don't know what the long-term consequence of this is, but I'm trying to equate it to other data breaches that happen. And let's take like Target had a big event that happened a few years ago. They're subject to all the financial data breach piece of that, but we have a unique challenge because we're not only subject to the financial part of folks identifying information, social security number, if you happen to have credit cards on file or any of that type of stuff, but then you add the HIPAA piece to it as well, which adds an extra level of regulation, complication, fines, fees, etc. And as of today, I haven't seen an update except that on the Aspen website, it now has a press release about the challenges that they're having of getting their offices back up and running. And so I do think it's hit them pretty hard. I do think that they are struggling to be able to meet the needs of the patients in their communities and get them back into the practice. And I'm sure financially that's been a big hit too. But my point in bringing all of that up is we're all subject and vulnerable to that same liability, whether we see millions of patients or, our 1,500 to 2,000 in our small private practices. So, if they're subject to it, then we all are as well. And this was a pretty big hit for them. And just a friendly reminder to make sure that we have our ducks in a row when it comes to trying to protect our servers as best as we can. And I'm going to use this as an educational opportunity for my team to remind them as well about not clicking on links and uploading things we don't know about. We don't check our personal emails on our work computers, and just those types of things that are just general good practice to protect the web space that we're operating in. But I've had local friends that got hit as well, so I know it can happen and it is prevalent. A couple other things that have come up this week. We've talked about this a few weeks now, but a continued effort and focus is being placed on workforce challenges in the dental space, actually in healthcare in general. So HRSA continues to meet with committee members from Congress to talk about strategies and to better understand the current challenges of workforce issues within medicine. It's not just exclusive to the dental field, but also the general scope of the medical community is suffering from being able to find good qualified staff, doctors, support team members, licensed professionals, etc. So they're trying to understand better the gap. How do they meet that more effectively to solve access to care issues, as well as fill empty and open positions? It'll be interesting to talk to our guests tonight, because the one thing that I do know about dental workforce is that we are graduating more dentists this year in 2023 and again in 2024 than we will have graduated in the last 20 years in a collective year, probably getting back closer to 1980 numbers. And so it'll be interesting to see, do we have a physician or a doctor workforce issue, or do we have support staff issues? And are we graduating enough of those support staff members to come in and backfill those empty positions with existing practitioners and new practitioners? So I don't have all the magic answers, but I think that's a big piece of this that we need to be watching. Lastly, interesting turn of events. So I'd mentioned just a few weeks ago, as the emergency standard is getting removed from the COVID pandemic, that was going to turn off the faucet on a large proportion of individuals who are on Medicaid funding. So for patients that had been receiving Medicaid funding throughout COVID, because there was a law or regulatory statement in place that did not allow states to remove individuals from the Medicaid roll during an emergency, that was going to shift once the emergency ended. And I think the official date was mid-May. Well, New York State, in an interesting turn of events, the court has ruled in favor of leaving individuals on the Medicaid roll as long as it's medically necessary. So that puts 5 million more individuals back on government subsidies for medical care and dental care. Obviously, there's some concerns about funding the programs and continuing to support that. And then there was a lot of banter today about what would be deemed medically necessary. What would the qualifications really need to be in order for a dentist or a medical professional to be able to say, yes, in fact, we need to do this procedure because it's medically necessary. It just starts to get in that very gray area, which we don't really have good parameters around. Even now, for dentists who want to bill for medical and they want to try to move benefits to medical, what's the gray area of, is this medically necessary dental treatment or not? So anyway, New York has gone on as the first state to buck the system on this new change. And we're seeing an additional 5 million to remain on the Medicaid roll moving through the latter half of 2023. So we'll see what that does for them financially. And with that, that's the news.
So I love, first of all, being up here to comment right away instead of waiting for Chad to allow me
I
to
also
come
like
back
not
up.
sitting up here by myself for 15 awkward seconds.
I'm sure the viewers would prefer just to be looking at you, but this does allow me to make a comment here and there. I really think, honestly, what have the last 5 years been, if not gray? I mean, we have lived in gray for the last 5 years. I don't think that there are any absolutes anymore.
Right.
But I think one of the most interesting things that you brought up in your news story, I think both relate to the same issue, which I think is we're seeing a fundamental change in our medical system. In our medical and our dental system, in not just access to care, but in the way in which we provide it as well. And I have some concerns. Over the last 2 years, I have said on multiple occasions and very outspokenly that I think we're going to see the pendulum move back towards the independent or small group practice dentist. I knew we were hitting a tipping point, because when corporations came in and started building practices, then buying local practices, all of a sudden they began competing against themselves. They're like,
Mhm.
wait a minute, they're not my competition when they come to town because I'm really offering a level of care that most of them don't have the ability to offer. So what am I worried about? But then I watch them all kind of build another office right down the road and another office right down the road. And then another company bought this other one's practice. And all of them are fighting for that same exact patient population. Most of them are fighting, for that PPO managed patient and for
Yep.
this insurance driven patient. And I've said all along, there's got to be a point at which, number one, patients say, I want, I want somebody who knows me. I want
Right.
somebody who truly cares about me as a person. I want to see the same person every time I go back, or at least have the people who see me know who I am and
Yep.
know my history. And I think people, regardless of economics, still expect a certain level of care. And that's a high bar that we set in dentistry a long time ago, is
Yep.
the level of care that we've established. I mean, and so to let it all move in that direction, I really think that the population, a lot of them are saying, you know what, I'll pay a couple of extra dollars. I want the kind of care that I'm used to, the individualized care. But now on top of that, you've got these entities that are all kind of competing against each other now,
Mhm.
and competing against themselves, building a second office so close. So it's not surprising. I understand the hack. That can happen to anybody, right?
Oh,
That's
sure.
not, yeah,
Absolutely.
that's not a corporate thing. But also we're starting to hear some talk online. And again, I can't validate this in any way. I don't have any kind of studies, but we're certainly hearing a lot of talk now online about difficulties on the employee side of working for some of these corporates, from hygienists to assistants to administrators to
Mhm.
dentists. And I really think we're seeing that pendulum swinging. So that was a big soapbox, but I'm
I
happy to
like it.
see it. Yeah,
Yeah. No,
I'm
I
just
like
happy
it.
to see it.
Same. Well, and I would also challenge the fact that I think um this is going to become more and more of a challenge if doctors are trying to leave the space, retire, whatever, and they've built practices in which now our new grads and our guests can talk a little bit about this. I think our new grads have so much debt they can't get financed for anything. So
Right.
then what do existing practitioners do as like how do we start coming up with creative exit strategies? Is it, buyer or owner financed? Is it, what are some interesting strategies, partnerships, equity buy-ins, et cetera? And we're just not adept to that type of mentality, but coming up with competitive alternatives that would allow private practitioners and small practices to have transitions that are, different. And we're not really set up quite yet, but I think the market is pushing for more levels of creativity to come up with those types of
Absolutely.
strategies.
Yeah, I
Yeah.
couldn't agree with you more. Well, I don't want to leave our guest in the wings for too much longer here. He's actually waited an extra 5 minutes for me to go off on that little soapbox. But what I love is that this is a person that can really contribute to this conversation on a very, very high level, because not only does he have a master's in public health, but he also started a scratch dental practice in 2005. He built it by basically founding it in comprehensive care and building rapport with his patients and collaborating with his patients and creating that type of practice, which I think puts him in a very unique category of dentists, but also in the category of dentists that will always succeed regardless of what the socioeconomic environment of dentistry looks like. there's always going to be room for a well-educated person, dentist, who also cares about customer service. And that's who I'm talking about when I talk about Dan Faber, our next guest. So Dan, I'm going to bring you up. I actually first learned of Dan. Hi, Dan, by the way. Cheers.
Hello. Oh, cheers. Yeah, no, I definitely want to start some serious conversations going on here. We got to.
Whoa, what do we have there?
Yeah. No, I heard this was going to be good.
Look at the layering.
So this is, so this is my, I came up with this during COVID, but I love kombucha. So it's like I swear by kombucha. I mean, but so I mixed it into my drink. So it's kombucha, buy the, berry, and then a little touch of tequila to spike it up a little bit. But, and a little touch of tagine, a little to give it a little color. It's nice.
Numb the gums a little bit. Yeah.
Yeah,
Well, anyway, cheers to you, Dan. Thanks for being on. But I do want to brag on you a little bit here and just kind of lay the foundation. So the way that I met Dan was actually through a Dental Nachos post. So our good friend Paul had put a post up, and he was just talking about sheer concern about the quality of clinical education that our D3s and D4s were getting, and are these students really well prepared for the world of clinical dentistry? And our esteemed guest here, who also was an educator, he had actually decided that his what he had done in practice was so valuable that he wanted to share it with dental students. And so he did that. He sold his practice and went off and became an educator, and I know was an excellent educator at that, not just an educator, but a true mentor. And unfortunately, he just made a comment about that he had some concerns about it, and that created some ripples, and it didn't work out as well as it could have in his educational position because he was outspoken. But I admire that, and thank you for doing that. And I think we truly need more people to stand up to administrators on the education side and to corporate interests that may be getting involved with dental education now, and just somebody to look out for the future of dentistry and for future dentists. So I'm not going to say too much more than that, but this is Dr. Dan Faber, and that's how I got to meet you. And we had probably almost an hour-long conversation on the phone. It took us a little while to get there, but once we got there, it's like we had known each other for years. And I admire you for everything that you're doing. So maybe give us your background and how you see what I've just described to all of our viewers.
Yeah, I mean, first of all, you guys were having an amazing conversation. As you guys were talking, I wanted to jump into what you were saying. So I hope we circle around back to that, because there's some really, really great stuff there in terms of what we could discuss. But thank you very much for having me on. I really appreciate it. And yeah, I mean, you pretty much gave it a pretty good, very good synopsis there. I made that post that actually was the first post I ever made on Facebook. So not something I was very used to. It was not intentional.
Some people went to jail for their first post, so I'm just saying.
Okay, well then I guess I'm ahead of the game then. But yeah, I mean, things didn't work. I mean, I love teaching. I love my students. That's really what really prompted me to write the post in the first place. Is I just care about the students. The other faculty there are great as well. The administration's just, they're kind of arrogant, to be honest, about, and even through this process, they never even came back to have a conversation about it. It was just very much like, well, we didn't like what you said, so that's it. There's no, they technically didn't fire me. I actually resigned because, they said I'm on paid leave or some silly stuff like that. Anyway, but they never wanted to have a conversation about it because I don't think they wanted to acknowledge what I was saying was true. And I think it's hard to argue against what's true. So I think that was really what went down. But I think more than anything, it opened up the conversation a lot more. More people are coming out speaking about their experiences in schools, other institutions, and DSOs about what's going on. And I think that's the most important part of the most important result of what happened from what I did. No hero or anything. It's just, just the way it went down. I wish more people, I purposely didn't want to be anonymous about it because I don't want to say something like that and then not back it up. I understand why people do that sometimes, but that wasn't what I wanted to do in my situation.
Can you give our viewers a brief synopsis of the post and just sort of your general concern, I guess, that you felt inclined enough to go forward publicly to state?
So really quickly, the way it happened was there was a post on Dental Nachos that said, it was just one of those surveys that says, do you think that dental students are you get enough clinical exposure, clinical experiences? That was the question. It was one of those surveys, and 99% of the people said no. And then in my comment, I wrote down a bunch of stuff, and then Paul Goodman actually saw my post. And he's like, wow, that's quite a share. He's like, would you want to post that? And I'm just like, okay. I wasn't like just, oh, okay. And I threw it up there. I knew what it meant to post. To be honest, I didn't know how many people were on Dental Nachos, but I posted it anyway. But
or at least in administration at the dental school. I mean,
yeah, right. So I was.
Here's a tip: try it on Dennis in the Know first.
You can try it on my group. That's the safest place to do it.
Yeah, exactly.
But yeah, so I mean, there's so many things. I think the gist of it is that they're not providing enough clinical experiences. The dental schools are, at least the one, I can only speak really for the one I was at. But from what I've been hearing and seeing from what other people are saying, it seems like it's more of a systemic issue, that schools are very focused on the bottom line, on making money, and doing things that are not necessarily in the best interest of students' clinical education. So, and I love the students. I think they're really smart. I call them kids, but I shouldn't call them kids. Really smart young people, and they're trying their best to do what they do in dental school. They're paying a lot of money to go there, like you said, with the debt, and they deserve a really good clinical education to come out and provide at least a base level, foundational level, like I feel like we had when we graduated, at least what I had. I felt like my clinical education was very good in the sense that I came out, I felt ready. They delivered on what I thought I should be receiving, and it's not the same as what I had. I feel like the best way to describe it, it's diluted, it's watered down, in the sense that they're not getting enough clinical exposures, and they're adding a lot more students and not necessarily increasing the resources. They're trying to expand into a different state, like with a new school, without even having, just to get more bodies in there to make. I mean, frankly, it's to make more money. I mean, I struggled a lot to understand the moves they were making a lot of the time, trying to understand what reason it was for other than that. And the only way it made sense was through the lens of making money. It's the only thing that ever made sense in some of the things they were doing.
Do you think there's, sorry,
Jeff. You go ahead, JB.
Just as a quick follow-up, do you think there's a difference between public, state-supported, and private institutions as far as their motivations, requirements, how they're moving in the marketplace, I guess?
I mean, I think probably most of them are technically not-for-profit, whether they're private institutions or public institutions. Most of them are nonprofit institutions, right? As an entity. So I think their motivations are probably the same. I'm sure they have more restrictions and more. If they're state run, if they're state schools, they have more restrictions because they get more subsidizing from the state. But I think they all have the same challenges of raising money. They have to raise a lot of money. They have to raise money from alumni the same way. I guess the benefit of being a state institution is they can try to get more money from the state. But I mean, I don't know if there's too much of a difference in that sense. I'm not, I'm not overly knowledgeable about that, but that's my kind of feeling on it.
Now, was there any corporate influence in the setting that you were in? Because we're seeing that now happening in other schools where some corporations are not only naming schools but putting a lot of money into them and certainly having some impact on the curriculum and the requirements. And was that something that was true of your institution?
Yeah, I mean, I'd seen students often told me, "Oh, we're going to some event or we're going to something," and there was definitely a tie in there with some institutions. And what you're saying really is, I think one of the most concerning things is it's working backwards, where the corporations are coming in and dictating almost curriculum. And I could see, and I think the main thing that I saw at the school was it was all about production, right? Like, let's just produce as much as possible. I mean, I saw the most horrible kind of things in the name of production against the students' interests. And
so I'm sorry to interrupt you, because that to me is, in all of my time in dental school, that is something I never, ever felt was like they wanted me to produce. I felt like, if anything, they wanted me to take longer in the clinic and
exactly.
And spend more time doing nothing and just getting the education. Jennifer, was that true for you as well?
Absolutely. Yeah. And the focus on procedures was for procedures' sake alone.
Yeah.
Right.
To get the experience to do all that.
Do it again. How profitable is that?
None. When it takes you 4 appointments to do a crown or 5 appointments to do a crown, like. And then the one guy that I was doing summer rotation with, his patient swallowed the crown at delivery date. So think about how many appointments. That was probably 12 hours of appointments to get to that moment where you're going to cement this sucker down, and then patient swallows it. You're back to square one.
You know, one of the most, I think, nausea-inducing moments I had was, I was not the head of the clinic or anything like that. You know how there's a separate clinics in the school. It had come down to the clinics that certain ones were not producing enough, and the head of the clinic had a specific meeting with the students, and I was there, and some of the about how our clinic was the worst because we weren't producing enough. I mean, and I know this. The person who had to run the meeting was like dry heaving, having to say this. I mean, they basically, forced it. He didn't want to be saying stuff like that either. It's like, so and the reason I brought up the whole thing about production was because it ties in with the idea of the corporate approach. The corporations come in and that's what they want. They're trying to cater to the philosophy of the DSOs and the corporations rather than just doing great care. That's the job. That's our job in school. My job, I felt like, was to train a dentist to be able to provide high quality care at a foundational level when they graduate. And that was clearly not, they didn't care about. I'm really focused on comprehensive treatment planning and all this kind of stuff. They had no interest in it. And I know that because I went to them and had conversations with them. They had no interest in it. Not only that, I'll say one other thing. There was a time one of the deans specifically said, he was all giddy one morning, and I happened to be there talking to him about something related to this, and he said he kind of like wanted to correct me, like as if I wasn't knowledgeable, and he said, we have I'm not going to say schools and names and things, but there was a very esteemed institution. Some of the heads of that institution were coming to observe how this school that I was at was doing business because they were producing a lot. So another school wanted to come in and learn how to do that. And this person was all giddy, and he was like, I don't think you understand that we work on a business model, this school. And I was like, I mean, I know business. I've been in business and stuff like that, but I was really, really struggling to understand what he meant by business model. Like how does a business model tie into your institution, and how is it different than the other model that existed before that? So it was like you don't really have to look too far to, I didn't have to imagine that this was going on. They told me it was going on. So
I just think about, Dan, 4 years of dental school, and I think about how much dentistry I really learned, which was minimal. Now, I will say what I learned was pretty damn good. Like, the people that taught me really cared about providing a good dental education. Everything I learned, I will say that, my instructors put their heart and soul into making sure I didn't go out there and hurt anybody or do anything wrong. But this really, I mean, what a gut punch that's got to be, especially when, you have one opportunity, you have 4 years to try to instill what's important in a dentist to somebody. And you're going to start talking about production at that point. You don't even have enough time to learn the dentistry in 4 years.
Right.
I'm not saying that there's not space for business acumen, because we all could use that. We all could use those business courses, and here's what you do in general practice, and here's how you do it so you can make a living. But isn't there a fiduciary obligation to first teach someone how to do the job without hurting somebody, and to do it in an ethically acceptable manner? I mean, that's the gut punch here, is to start introducing production at a point where people don't even know the top of a tooth from the bottom of the tooth. It just,
that's
tough.
why. Yeah, that's why. I mean, that's why my focus was on treatment planning, and that's why I'm still focused on treatment planning as dentists come out, because I know they're not really focusing on it in school. And I always, I think everybody kind of uses this expression about a tooth mechanic. I feel like that's what DSOs want. They want tooth mechanics, right? They want people who are going to come out on the assembly line and start hammering away, and that's not really a doctor. A doctor is technically a teacher, right? That's where the word comes from. But a doctor is at least somebody who plans treatment plans, communicates with patients. I mean, that's the foundation of everything. So to not be able to graduate and have any kind of basis of that, they learn some element of treatment planning, but it's not. I know for a fact it's not anything that great, because I was doing it with them in school. I would actually do it. I would actually have sessions like this, like we're having, like face-to-face virtually. I would actually do that with the students just on my own time, because they were not getting it in the clinic, and they gave them no time to have it, because all they wanted to do was churn.
Well, is the pricing structure still similar? I mean, I'm, what am I, 15, 16 years out. Jeff is like 250 years out.
Yeah.
And so
I'm 20 flogging years out or something like that. Yeah.
I think you did the first dinosaur root canal. Is that correct?
I did.
Yeah,
GB Black was my mentor.
Yes. But my point is the pricing structure for services, because I've tried to refer patients a few times to the dental school, and I used to say, well, you don't pay with money, you pay with your time. And if you have a lot of time and you don't have a lot of money, the dental school is a perfect place for you, because you're going to go 1,200 times, but it probably won't cost you, a couple $100 or something. I'm not sure that's actually true either anymore. And I am disconnected.
And they were going to make sure
I don't
it was
really
right.
know.
Someone was going to stand over that student and make sure it was right.
Yeah.
Yeah, I mean, yes. I mean, well, while I was there, and I discovered teaching. I was in practice. I fell into teaching. I wasn't even teaching. I was teaching maybe for like a year, like almost 2 years. But I really kind of fell in love with it. And I realized, I could do it, and I was good at it, and I liked it, and I was connecting with the students. But I realized there was a lot wrong. But while even in that short time I was there, I don't remember how much they increased their prices, but they massively boosted the fee schedule to the point where, because I was talking to one of my friends, in private practice, actually at my practice where I owned, and the pricing wasn't even that different. And we're in a nice area, in Connecticut, and this was not the fees were not drastically different. So I always struggled to understand why patients would go to the school if they could. Yeah. I mean, I think it's just they didn't know. It's lack of knowledge. They assume that they go to the school and everybody's they're getting so much better treatment because they have all these doctors around watching and seeing, and they have access to all these specialists and all that kind of thing. And it's like, So, I mean, I did, and I have to say, like, the faculty there does do a diligent job teaching and really trying to do their best, but they're under the thumb of the school, really pushing their agenda. They can only do as much as that. And not everybody was, speaking up really at all when I was there. They don't want to. They don't want to lose their jobs.
Yeah.
Well,
And apparently you can lose your job if you say something.
But I mean, it's another arm of cancel culture. It's another arm of bullying, honestly. And like, we should be able to voice our opinion that we don't feel like our students are getting as strong. Let's debate it. Let's sit out in a public forum and debate whether or not our students, if you're right, great. I will apologize and say, you know what? You've proven your point. You are right. They are getting a good education. But just to mention your concerns as a clinical dentist, as a caring instructor, and then to get canceled, forgive me for using that term, but that's what it is. I just think it's cowardice, and I think it's just another arm of where we are now socially, that you either conform or you go away, and I hate it.
It's kind of an extension of a whole woke kind of culture that, it's conformity, not letting someone be individual, express their unique perspective and opinion. It's like, it's either you're this way or you don't belong. Right. So I think that is a big problem. I agree.
What do you think, if you could look in your crystal ball?
Hold it. Let me.
Yeah, if you could get it out. I say that to patients all the time. They're
That's
like,
the crystal ball. I like his crystal ball.
Yeah, I do. I like his crystal ball way better than mine, because patients are forever asking you. I mean, like, is it going to be this year that it breaks?
Oh,
And I'm
Mr.
like,
Tequila Kombucha. Oh, Mr. Tequila Kombucha.
It does work. It does work like that.
What are a few things that solves this? Like, what it's fine to bitch about it, and we all do, and we all see the issues going on. But since you've been both in private practice and in the dental school, and you've sort of made that bridge a bit, like, what are some of the things, maybe 3 things, couple of top things that would reset this and put it back on the right trajectory towards good?
Well, I think part of it is something. So this kind of ties into what I'm kind of doing is just continuing to advocate. So, bringing attention to it, like call them out on their stuff, right? Like, don't just let it happen. I see a lot of stuff online, like people are just like, well, that's the way it is. How are you going to stop them? What's their downside? And I respond, and my response to that actually was, well, I want to be their downside. I want to, if you're vocal enough and you bring enough attention to something, people start saying, like, students applying might say, well, this is what the word on this school is because they do X, Y, Z. That's part of it. But that's like the advocacy, public health kind of stuff, which I like. But I'm more into like the grassroots, like taking action, like advocacy and action, right? What can you do to actually make a difference? And I think that's teaching outside the school. The way I kind of see like the trajectory of a dentist coming out now is, if they're going to be watered down and they're going to in their clinical experiences and their education, and they're coming out and they have this crazy debt, they have to be very intentional about their career, more than when we were coming out, right? When we came out, we kind of could, be a little looser about things. You go do your GPR, find a practice to work in. You could start a practice. There weren't DSOs, right? At least when I was graduating, there wasn't, that didn't really exist. You just had a little bit of more gradual step into the real world, if you will. But now I think they have to be very intentional when they just think about it. They're coming out. If I agree with you that I'm hoping that you're right about the tipping point back to, private, more of the individual dentist, the dentist running the practice. But, right now you have this, the DSOs are taking over a lot more and more. They control a decent amount of the market, and they're continuing to take over a little bit or a lot. And if that's where dentists have to go, then how are we going to make sure that they boost their quality and maintain their quality? So it's like what's the word? not vicious storm, whatever the term is, perfect storm, if you will. You have people, you have school, you have not bad education, diluted education at school. They come out, they're not ready. They don't really have a place to go that's going to teach them, that's going to mentor them. So they have to be more intentional about finding mentors, finding education, kind of have a blueprint. What am I going to do? This is what I want to learn. And really think about how they're going to go forward. Because the chances of them, having a corporation be a mentor isn't going to happen. Like, mentors are not corporations. Mentors are people. So where are those mentors? Like, we used to have, like, dentistry was very much an apprenticeship kind of profession where someone took you under your wing, hopefully, and you learned. That's how the great things tend to happen. But that's going to be diluted as well as you said, these dentists retiring. Who's going to take over? If the DSOs are taking over, who's taking over their mentor capability? I don't know.
You bring up another interesting point because, and again, this is another reason I feel like we've reached a tipping point too, because if we're going to produce this watered down version of dentists that really are catering to the DSO or the corporate market, what then is going to happen? So to your point about having a mentor, seeking out other education that makes you somehow different than all the others, this is another tipping point that I see, because what happens when we put out all of these diluted dentists that are really just trained to work in the corporate world to pump out a lot of dentistry? What happens then when we start to see more of the mid-level provider? What happens when we start to see that technician? Because honestly, when you talk about somebody who just knows how to do something, that's a technician of sorts. Are you a clinician or are you a technician? A technician is someone who knows how to do something. I can tell you, my assistant Cindy, that has worked with me for 25 years, can probably do better class 2 restorations than virtually any 3rd or 4th year out of school dentist can do. I mean, she is absolutely as qualified to do dentistry as a lot of other people are. But it goes so much beyond that. So what happens when we start training those mid-level providers and we start allowing those mid-level providers? Who do you think that the corporates and the DSOs are going to hire in their profitability scheme? What makes more sense? Are they going to keep hiring dentists, or are they going to hire a bunch of people who just know technically how to do the job, right? And then what's going to happen to all of these dentists that have been trained at this level, but they're like, why would I pay you a dentist salary when I can hire a mid-level provider and have one dentist on staff that oversees all of them? And we don't need all of you dentists. Again, this is just another reason I see that tipping point.
Yeah, I mean, obviously your argument's rhetorical. It's gonna, the choice that they're gonna make is obvious. The same thing that like with Uber, when they're saying when automated cars come out, what do you think Uber's going to do? You think they're going to still hire drivers? No way. Right. So it's the same argument. And I don't know. That's a great question. I have no idea, what happens to dentists who can't be dentists or have no place to be. It's only it's going to be like they can do only the things that they don't allow the technicians to do, I guess. I don't know.
But assuming education will allow them to make themselves more unique. To make that, education is the answer to all of this.
Yeah.
Right?
Yeah.
I mean, a dentist who knows more, that can offer more, that can be a true clinician. I mean, those don't grow on trees anymore.
Right.
So I really see education coming the other way. I see dentistry going the other way. I hope I'm overly optimistic.
But the other question though is what happens. I mean, we assume that this will happen. The technicians will take over and all that, and the DSOs will. But it will reveal itself at some point because the quality won't be there. So just because a DSO has a quota for volume of crowns for a month, that's not a it doesn't mean that it's going to be good dentistry or that they deserve, or you should be doing these many crowns. Things will go bad. People will eventually, it's kind of like a dumbing down of the profession in a way, but you can only dumb it down so much before patients get smart and they're like, well, this isn't working. So who's going to be able to take care of me? I think it's kind of like the, I don't know if I could say the, what the perspective is on that. What's that thing? The Smile Direct Club, that kind of thing. Like that's going to reveal it. I mean, it already has revealed itself, right?
It already has, yeah.
Right. If someone goes in with an implant and they don't know they have an implant when they make them the trays, and all of a sudden their teeth get messed up and their occlusions get messed up and their teeth start breaking, people stop going to Smile Direct Club, right? So it could, I mean, that's a microcosm of maybe the way this could be going. I mean, I think. And that's kind of like my big picture, my whole big picture mission that you talked about. You talked about access to care. My thing isn't about access to care; it's access to higher quality care, right? Because like you said, we're churning out a lot of dentists. That doesn't mean, I'm not saying they're low quality, but that doesn't mean that they're higher quality. We're not necessarily, we could be churning out a lot of dentists that are like just the whole watered down term we've been using. I've been using has been that could be what's happening. You said we graduated more dentists this year than I think you said ever before.
Yeah, maybe since the 80s. Yeah.
Right, but if you compare it to the quality wise, I don't know how you do that exactly. Yeah, I mean, I don't know.
And who didn't love the 80s?
I don't know. I don't remember.
I love the 80s. And my kids know I love the 80s because I keep playing the music and they get annoyed.
Yes.
Exactly.
I love the music and movies.
Real quick, Dan, because we're actually running out of time. This was just such a great spirited discussion. I could do this all night. But tell us about dentists making a difference. Tell us about your platform and what you're trying to do now with the future.
Yeah, so it's just that, I mean, like I said, that post was the first post I made. So Facebook isn't exactly, I'm not a Facebook expert or anything, but I started the group really just as an extension of my vision of what I'm doing. And I'm hoping other people kind of join me on that. It's more like a movement, right? Where, and the goal is really just making a difference for every facet, for the dentists themselves who are joining. Like we want to level them up, right? All of us, right? Level each other up. Help aspiring dentists, help dental students, and the profession itself, and obviously patients on the back end. It's kind of like it's its own public health kind of thing. That's really what it's about. It's really that simple.
That's it. So what are your goals for the future? Tell me what does the future look like for Dan Faber?
Yeah, no, so my whole goal after this whole thing happened was really, because I really do love teaching. I want to get back into teaching. I want nothing to do with being in a dental school. I really don't. I don't like the bureaucracy. I don't like them trying to tell me the way I need to be teaching, because obviously my agenda might not line up with theirs. And but I do want to find my way back into teaching. And so I'm going to be teaching outside of the schools, and I'm working on a few things in terms of testing a few things out. But I know it's going to be needed. I know it's needed on multiple levels, and it's communicating with patients, because when they graduate and they're just focusing on production, they're not focusing on communicating with patients. They're not focusing on actually treatment planning. They're not focusing on all those kinds of elements that really do make a difference for a dentist. And when they come out and go into corporate practices, they're still not really building those skills that much. It's just more production. So where do they learn that? Like we discussed. So that's kind of that's the hole I'm trying to fill. No pun intended.
Well, we appreciate it so much.
Yeah. We put the sound effect in later.
Yeah. I'll have it added.
Anyway, JB, would you like to close us out tonight?
I would love to. First off, Dan,
so.
Thank you so much for being here. I think we can't talk about this enough. And to your point, there are lots of ideas on how to solve the problem. Some who are actually in the problem, some who have experienced the problem, many who have never seen the problem, all putting their hands in the pot to make it better, which sounds slightly dangerous to me. So we have to be loud. We have to advocate. I'm a huge fan of grassroots and a huge fan of you, and really appreciate everything that you're doing for dentists and for patients, so that we can continue to be the clinicians and physicians of the mouth that we were originally all trained to be. So thank you. Thank you for being on tonight. Thank you for what you're doing.
Thank you very much thank you very much for having me. I'm really humbled by being here. I mean, 2 months ago, I was like, I was nowhere near doing any of this stuff. I was just teaching in school and doing my thing and seeing some patients. And then, I'm here talking to you, and you guys, you believe it or not, you guys are public health servants for what you're doing here. So you're bringing attention to lots of issues that need to have attention. So I really appreciate that.
Much appreciated. Thanks so much for watching tonight. Thanks for tuning in. Thanks for continuing to be loyal and faithful followers of our brand here on Facebook, YouTube, and podcast channels, wherever they're available to you. We hope you have a great rest of the week. If Taylor Swift in Nashville happens to be on your agenda, I hope you thoroughly enjoy it. Glitter and sequins are encouraged. With that, have a great night.
Good night, everyone. Thank you.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.